Hi you guys, happy Super Bowl Sunday to you, 2020. Welcome to my channel. My name is Jennifer. I am having conversion surgery from VSG to gastric bypass in 10 days on February 12th. So I am getting a little nervous about it, but I wanted to talk about sort of the steps that I've taken in order to get to this point, some of the journey that I've had, also some of the pre-op requirements that I had to go through, and things that I still need to do before surgery, and just sort of talk about just some general stuff thrown in there too. So I had VSG surgery 3 years ago in January of 2017. So I am literally 3 years post-op right now. So my highest weight was 261. My lowest weight was 162. I'm averaging in the 175s. Right now I think today I'm at 174-ish. So I'm not having the conversion surgery for weight gain. I'm having it because I have severe acid reflux that's caused a lot of erosion, Barrett's esophagus, a lot of pain and discomfort, and my quality of life is definitely affected by this on a daily basis. And so it's kind of come to a point where I need to sort of think about my future self and my wellness, and so this is something I kind of need to do while I'm still young enough and sort of while I can kind of catch it a little sooner. And of course I tried everything I could before we got to this point. This is a last kind of the most extreme way to cure, hopefully cure acid reflux, but this is like the last resort option. So I actually went to my doctor a year and a half ago, requested conversion surgery because I knew straight out from VSG having the surgery that, to be honest, I think I knew pretty early on and was already having some thoughts before surgery that maybe I should be going the gastric bypass route. But I did not heed my little inner voice and I went with VSG. My doctor had advised me that it shouldn't make it worse. And so I trusted that, and it did get worse. And so there is a small percentage of VSG patients that already have acid reflux that it could be cured. There's also a very small amount of patients that it can get worse. And so I was one of the people that it did. It got severely, severely worse. And so that's why I'm doing this. I'm very nervous about it, which is why I want to talk about it, because that's a little bit therapeutic for me. And I appreciate all your feedback. Please, anything you have to share, please leave it in the comments below. I so appreciate that. So right now, I did not have to do the 6 months of the nutrition classes like I had to do the first time. All I really did is I did my pre-admission with the hospital already. I did pre-op labs, but I also am 3 years post-op from VSG, so I also had all of the labs associated with my 3 years from surgery. And so I had an appointment just yesterday with she's a PA, and she handles all the patients after surgery because my surgeon is actually a little bit of a distance away, and so she's a local physician's assistant, I guess it's called, which is like one step below a doctor. And so she handles all of the labs. She gives advice about not the foods, but the actual how our bodies are doing with like the vitamin panels and all of that stuff. And so I saw her, which I have some news about that because I have some big stuff that was discovered from my 3-year labs. And then I also next week will be seeing my endocrinologist because my TSH, I've talked about my thyroid issues. And so the last time I had my TSH checked, it was 78. That was 2 months ago. And now I just had it checked, and now it was like 0.02. And so I'm actually a little high thyroid, where before I was very low thyroid. So my numbers fluctuate really, really badly with my Graves' disease and my thyroid condition, but that's like another appointment that I have to do. But I still need to do my pre-op. It's a pre-op, like literally a nutrition course for the RNY. And then I also have to do my pre-op with my doctor, and I still need to get an EKG. And then that's all I have to do left. And then I will be having surgery on February 12th, which I just cannot believe it's so soon and so close. And there's so much happening in my life. The timing is actually completely horrible, but I'll get into that in a second too. But I want to talk about my 3-year post-op labs that I did with the PA. So they do this whole spectrum of labs, and it turns out that I am vitamin K deficient, and my ferritin is low. So basically I am anemic, which I didn't know that before. And so that's something new. And this vitamin K is the thing that helps our body, I guess, like do blood clotting. And it is very crucial to get this fixed before I have this humongous surgery in a couple weeks, because in that surgery they're going to very likely do the hiatal hernia repair, and I also have like a little growth on my stomach that will have to be addressed if it's found that it is literally there, because there's a question on whether or not it was just a difficult reading from the upper GI. And my weight loss surgery doctor, who has more experience with our procedures, he kind of questions whether or not it was an accurate reading from the doctor that read the results of the upper GI. So we'll see. So we don't really know what's going to happen at surgery. I'm going to, at least I know for sure, getting the RNY. I don't know if he's going to do the hiatal hernia repair. I don't know if there's that growth. So I don't really know what's going to be happening. But vitamin K is crucial for to be in a good range pre-op. So I've immediately started all this vitamin K replacement, and a prescription with the pharmacy and all that stuff. But I do want to talk about the timing of all of this. So in my personal life, I actually am the chapter president for our local union, and we are approaching bargaining because our contract is going to expire this year. And so I've been having to do site meetings and doing a lot of presentations and a lot of contact with my coworkers. I have also, and so that is very much on my mind, but I'm also doing all of these pre-op appointments. And I'm also, seriously, the timing is just, I'm also trying to promote to a new job. And so I've had to create my resume and my application and do all this. And then on Tuesday, I have to do the testing for that. And then assuming I pass the test, then there could be interviews. And this is all happening right as I'm about to have this humongous surgery. And if I were to get that job, it is completely different from what I'm doing now. So it'd be learning like a whole new thing. And so it's like, oh my God, the timing. But this is like a very rare opportunity. This job, there's only one position like this in my whole where I work. And so it's not like it's a job that comes up a lot. And I really, really want it. So I'm going to have to go for it, even if I have to go in there, because it's very likely the interview process will occur post-op. And so, yeah, we'll see how that goes. But there's something completely, you're not going to believe this. But so you guys know, I've talked about that my daughter, Amanda, she had gastric bypass in October of 2018. Yeah, 2018. And she did fantastic. She is a full-on super loser. She is totally thin now, and I'm trying to get her to do a video with me, but our schedules, but it's just more like a timing thing. She has lost, and I don't want to give away too much, but she has lost, I'll just say it's more than this, but she's lost over 150 pounds, and she is just doing so phenomenal. It's like out of this world phenomenal with her success with having gastric bypass. But there's more. So I have one brother, his name is Jason, and I'll bet he's watching. Hi, Jason. So he is having gastric bypass as well. And I'm having my conversion surgery on February 12th. My brother Jason is having gastric bypass on February 18th. Yes. So 6 days after I have mine, he's going to have his. Oh my gosh. So that's crazy right there. But there's more. Our mother is going to come from Placerville, and she's going to stay with me and kind of take care of me a little bit post-op here, and she's going to stay at my house. And then my dad is going to come on the 18th with they have an RV because they've got like 4 dogs. And I live in a place that I have a campground like a minute and a half from my house, because I live in a touristy, beautiful state park-ish kind of environment. So we've got a campground right there. So my dad's going to come. So my mom's going to come. She's going to stay at my house with me, help me, and then so that way she'll be here for me, and then she'll be here for my brother on the 18th when he has his surgery, and then so she'll leave my house and she'll go stay at the RV with my dad, and then my brother and his wife are going to come and stay at my house for whatever recovery period that he needs, whether it's a week or more. They'll stay here because I do have a guest bedroom, because where they live, they have a very, very bumpy road, and just, post-op, how sensitive your stomach is, very sore and uncomfortable, and you need some sort of just some resources. And so just to make sure that he's very comfortable, he's going to stay at my place for as long as he needs. And so I'm trying to prep for not only my surgery, but I'm trying to prep for his surgery, and I'm trying to prep for house guests. So trying to get that space ready and get my house all kind of set up for having multiple people staying here, and even when my mom leaves, then she'll still be here. She'll be, being here at the house, and my dad being here. So there's going to be a lot of people here, and it's just a lot going on between the my union duties. That is huge right now. Me going for a new job, that is huge. Me prepping for my own conversion surgery, but also trying to manage me being a 3-year post-op VSG patient, trying to deal with those appointments, trying to deal with doing my I kind of consider it my pre-op appointment with my endocrinologist to make sure my thyroid is under control, and my osteoporosis is she's aware of what like all of a lot of these nutrients like vitamin K. That is actually huge, and magnesium and iron, that's all huge for osteoporosis. And so trying to get my body kind of prepped for surgery, and then the fact that I'm having this huge sort of unknown surgery in just 10 days, there's just so much going on in my life. And one of the issues also is that being anemic and having this low being vitamin K deficient, it affects energy levels. And so it really does explain why my energy levels have been so low. But I'm excited to be able to get some relief from this acid reflux. It affects my life. And actually, you see where I'm sitting right now? This is actually where I sleep. I would say 80% of the time, because I have to sleep upright. And so this is actually my bed. It's not, I didn't sleep here last night. I actually slept in my bed most of the night. And then I had to come out here because I had a migraine this morning. But there's a lot going on in my life, but there's a lot of positives going on. I'm so grateful to have this community and have all of your support. It's just, it's kind of scary. I mean, I'm not gonna lie. There's not a lot of videos about people having conversion surgery, and my biggest fear really is I'm literally afraid that I'm actually going to gain weight from surgery, because what I'm hearing from a lot of other people's videos is that there is more literal restriction with VSG surgery. And I've talked a lot about how I have a very, very great restriction. I have a very firm, full point where I get full really easy. I'm able to eat small quantities of food and feel a very strong feeling of fullness and a very comfortable feeling of fullness. What I've heard is that because my stomach is now going to be kind of cut in half, the pouch will be smaller, and then it will basically go straight from that little pouch. It'll go straight into my intestines. So it doesn't have, how it's been explained to me is that what creates the sort of like the end part of the stomach is actually scar tissue from the stomach. And so if some people could have more scar tissue than others, and so I hate to say it, but I hope I do have good scar tissue just to keep that, because I want to feel that feeling of fullness. Last night I asked Amanda, does she know when she's full? Because that's one thing I hear a lot of RNY patients talking about, is that unknown feeling of fullness. And you know what she said? She said she does not feel any physical sensation in her stomach whatsoever. That's not a good sign. What she has figured out is that when she is full, she gets a runny nose. That's how she knows that she needs to stop eating. That is crazy to me. When I get full, I feel full. I feel like I just ate enough food, and I feel a feeling of fullness in my stomach. I don't have any other physical symptoms of fullness. I just feel full. And so I stop eating because I know that I can't eat anymore. where she feels no physical sensation in her stomach, that she does not feel a sensation of fullness, that terrifies me. And I think I've said from the get-go after her surgery is that I always have felt like she could literally eat more than I do, that I physically can. It's just she has such strong food aversions that she just doesn't eat a lot of food. But that scares me. That scares me a lot, because I'm used to my body. I know my body. I know what I can basically eat anything except I think the only thing that I literally cannot ingest is carbonated beverages, because it does. I mean, I had got something for my daughter, and I was so thirsty. I actually had a sip of this soda that I had got for her, and it wasn't for my Amanda. It was for my other daughter, and I had a sip because I was so thirsty, and I just had one little sip, and my stomach just felt like went poof. And so it's like carbonation, and I do not agree. I cannot ingest carbonation, but that's like it. She can totally drink carbonation. She could probably literally eat. She needs to be cautious of dumping syndrome, but I mean, the food just like goes like right through her stomach. So she apparently did not have a lot of scar tissue to cause that little area to sort of close up a little bit. So that terrifies me. Oh my gosh. So anyway, so that's probably my biggest fear right now is the recovery time when I'm already going through so much in my personal life, and I'm very scared about regain. Very, very, very scared about that, because that hasn't been something that yeah. Anyway, I'm rambling. My own little fears are kind of getting the best of me right now. So if you have any suggestions, any feedback, if you have had conversion surgery, I would love to hear your experience. Or if you know of any other tips or things. Oh, and one thing I did do, I don't know if I mentioned this, I actually last week, and this is where I actually learned about that whole scar tissue thing, is I went to my pre-admission required bariatric class that my surgeon requires that all of his bariatric patients go. And so I'd gone 3 years ago for the VSG, but now I had to go for the RNY. And it was like, here I am at 175 pounds in this room, and the gal next to me was probably 350 pounds, and the other gal was probably a good 300 pounds. And I walk in the door, and they're like, what the heck is she doing here? But then I quickly explained why I was there, so they were like, oh, okay. And then as we were doing the class, both of the other gals that were there, they were both getting VSG. So I was actually able to participate more and give my personal experience regarding VSG. And it turns out actually one of the gals has my same surgeon too. So that was kind of interesting. But I'll let you guys go. Thank you so much for watching. If you haven't subscribed, please do so. Please like this video. That means a lot to me, and I will see you soon. I'm going to try to do more updates beforehand, before my surgery, because there's so much going on in my life and so much happening in terms of my health. But I do want to sort of document a lot more about what I can do now compared to what I will be able to after surgery. And so that's kind of where I'm at. Guess that's kind of it. And I hope you guys have a great day. Enjoy your Super Bowl Sunday. And I will see you very, very soon. Bye, you guys.